Open enrollment for people with Medicare ends December 7th. And now, while healthcare costs rank most stressful among common living expenses for seniors, a new report called the Cost of Complacency reveals that seniors are more likely to comparison shop for groceries, gas, cable and internet service, and even travel deals than they are to shop for a Medicare plan. So Bart Astor is here to discuss the risks that seniors face when they don't take the time to review their Medicare plans. Bart, thank you so much for being with us.
My pleasure to be here. Thank you.
And can we actually start with a little bit more on that survey that I was just talking about?
Sure. The WellCare Cost of Complacency survey polled over 1,000 seniors to gauge their attitude and behaviors towards their health care. And as you pointed out, despite the fact that it is the most burdensome of their living expenses, even more than food and groceries and utilities and transportation, they don't comparison shop for it as much as they do some of the other things in their lives, like cable and internet service, or travel expenses, or or gas. And that's a little bit disturbing, a little bit surprising too. In fact, the survey showed that over 60% do not review their Medicare coverage annually. And I think that leaves people vulnerable and obviously potentially leaving money on the table.
Well, and I did say that open enrollment closes on December 7th. Is it too late to kind of go over the plans?
No, I think there's a lot of time to really take the time to look at what is available to you and what are your health needs. Now, we know that it can be an unpleasant experience. In fact, many seniors report that it is more unpleasant even than going to the DMV to renew their their driver's license rather, or even more unpleasant than doing their taxes. But it's so important to just take the time, review what your plan is and what your needs are for the future. And there are lots of ways that you can do that. Lots of help for you.
Well, and also as you're reviewing things, low premium isn't always the best option for everyone. And I think that maybe that might be a myth that some people believe.
Sure, it's certainly one of the costs that you consider, but remember that the premium is only one part of the costs. You may have deductibles that you're going to have to meet, and you may have co-pays for when you go see certain doctors. In addition, you could run into lifetime limits on certain diagnostic tests, such as whether you're going to need an MRI or PET scan. But there are ways that you can kind of compare apples to apples and to make sure that you have the most coverage, the best kind of coverage for you, so that if you need vision care or you need dental care, that you include that in the kind of coverage that you can avail yourself of.
Well, since
and the best way to go is to go Medicare.gov. Go ahead, sorry.
Oh, no, that's perfect. That's actually what I was going to ask you, since you were saying we do have time to still kind of review the plan, see what fits us best. Where can we go online to get more information, and actually more on this survey that we were talking about?
Absolutely. Well, costofcomplacency.com is to get more about the information, more information about the survey, as well as about information about your Medicare plan. And also Medicare.gov is a wonderful site to just really provide you with the information you need, and your local senior center that can help guide you to make the right decisions for you.
Well, Bart, I'm glad we're talking about this just in time. Thank you so much for taking a moment with us.
My pleasure. Thank you.
Don't go anywhere. We'll be right back.